Today I am going to discuss the Dopplers in pregnancy. Why we have to do Dopplers, when we have to do Dopplers, and what is the importance of the Dopplers in the pregnancy, and what are the uses of the Doppler in pregnancy. Why it is done? Dopplers are mainly useful to check the blood flows to the fetus, and in this for doing the Dopplers we use the ultrasound. In the ultrasound, along with the Dopplers, we check for the fetal growth, weight of the baby, liquor, we check for the blood flows and also the fetal heart rate and position of the fetus. What are the types of Dopplers we have? Uterine artery Doppler, umbilical artery Doppler, middle cerebral artery Doppler and ductus venosus Doppler. Uterine artery Doppler. It tells about the blood flows to the uterus. Umbilical artery Doppler. Umbilical cord which connects the fetus to the placenta has the umbilical arteries and umbilical vein. By doing the umbilical artery Doppler, we can tell about the blood flows to the fetus and the placenta. Blood flows, how good the placenta is functioning. Middle cerebral artery. Middle cerebral artery is present in the fetal brain. It tells about the blood flows to the fetal brain. Ductus venosus Doppler. Ductus venous Doppler tells about the blood flows to the fetal heart. What is the importance of this Dopplers? When we do? When Doppler is done? Doppler is done in the first trimester, second trimester and in the third trimester. What is the importance of the Doppler? We mainly use for the diagnostic purposes and prognostic purposes. In the diagnostic purpose, in the first trimester, we do it for the screening for the preeclampsia and also in the third trimester to classify them in the early, late, FGR and small for gestational age fetuses. For the prognosticating purposes, it helps in deciding the delivery whether it should be done before 37 weeks. That is whether we have to do preterm delivery or not based on these Doppler findings. Now, what are the uses of the Doppler in the pregnancy? Doppler is used mainly in the management of the fetal growth restriction, in screening for preterm preeclampsia in the first trimester, and in the medical disorders complicating pregnancy like diabetes mellitus, chronic hypertension, preeclampsia, autoimmune disorders like systemic lupus erythematosus, and in the management of the multiple pregnancies. In multiple pregnancy, twin pregnancy, we have monochorionic diamniotic twins and the dichorionic diamniotic twins. Among these, in monochorionic diamniotic twins, as the complications are more like twin-to-twin transfusion syndrome, twin anemia polycythemia sequence, twin reversed arterial perfusion sequence, and selective fetal growth restriction. As all these complications are more in the twin pregnancies, we monitor these cases by Dopplers. And also for staging of the TTTS and the TAPS, these Dopplers are used in the pregnancy. So, ultrasound is a good screening tool for the assessment of the blood flows to the fetus. So, ultrasound is a good screening tool for the Doppler measurements. So, ultrasound should be done at a proper center by the trained fetal medicine specialist. Thank you.